Hello, my name is Deborah Keller, and I have the privilege of serving as the Director of Clinical and Quality Improvement for the National Healthcare for the Homeless Council. I'm also a practicing primary care and addiction medicine physician based in Philadelphia, Pennsylvania. I'm honored to be here today with Caitlin Sinovic, the Assistant Director of Medical Respite at the Council, who is an occupational therapist with clinical expertise in the care of older adults and individuals with disabilities. We will be sharing a brief overview of the topic of supporting older adults experiencing homelessness with a focus on behavioral health needs. We will highlight the reason this topic is of growing importance, and we will introduce a number of educational resources our team has developed to provide community-based education for service providers who are supporting this population. To tell you a little bit about the National Healthcare for the Homeless Council, our mission statement is on the right. Grounded in human rights and social justice, the National Healthcare for the Homeless Council's mission is to build an equitable, high-quality healthcare system through training, research, and advocacy in the movement to end homelessness. Our work at the Council is guided and empowered by individuals working on the front lines, individuals with lived expertise of homelessness through our National Consumer Advisory Board, by clinicians, administrators, public health officials, researchers, and members of healthcare systems at large who participate in a variety of council committees and work groups. This approach, directly learning from the populations in need of support and services, and from the frontline providers innovating and being responsive to the needs on the ground, will be reflected in the content we provide today and also in the process we use to develop our educational materials.
Before we go into the specific educational materials we developed, we want to give a background around the state of older adult homelessness within the United States. Generally, the cutoff age for what is considered an older adult varies. In the United States, we often think about those who are ages 62 or 65 and older, often in direct relation to services and benefits they may be eligible for. However, adults experiencing homelessness often experience geriatric conditions, which we'll talk about a little bit later, much earlier than their housed counterparts, often 15 to 20 years earlier. For that reason, in the homelessness response world, we often use a cutoff age of 50 or 55 when we're describing older adults, and that's who we're going to include in this conversation today. This older adult population experiencing homelessness is comprised of individuals who have been chronically homeless and who are those experiencing homelessness for the first time. This cohort is the fastest growing group of people experiencing homelessness in the United States currently, experiencing homelessness for the first time at an older age. It is also notable to point out that almost half of older adults experiencing homelessness are unsheltered, which means that they are not staying in a shelter, an emergency shelter setting. So we're going to dig into these two different groups of older adults experiencing homelessness. First, we're going to talk about older adults who have experienced chronic homelessness. 1/3 to half of older adults experiencing homelessness had their first episode of being unhoused before the age of 50. Once they're unhoused, these adults experience worsening health conditions and limited access to health care. These health conditions are further affected by co-occurring behavioral health conditions like substance use or serious mental illness, which may have developed or worsened with the onset of homelessness. As these individuals age, the experience of chronic homelessness accelerates these conditions and contributes to that onset of geriatric conditions. When folks are living in restricted environments, such as shelters or encampments without running water, self-care and health management activities become more challenging. It is for these reasons that folks often become stuck in the cycle of homelessness with worsening health and an inability to move back into employment or obtain any sort of consistent economic supports, along with a lack of affordable housing options. These folks then often move into homelessness as they are aging. The second group of older adults experiencing homelessness are those who are experiencing homelessness for the first time as an older adult or a senior. These are individuals who are often lower income, who are more likely to move into housing instability because of a lack of economic support. For these individuals, events such as a significant health event, such as a stroke, heart attack, or other health condition, can contribute to a loss of housing or a loss of income, especially if they are not yet retired or receiving any benefits. Additionally, folks may have a loss of income due to job loss related to health conditions, aging. They may also have a loss of income with a loss of caregivers or support systems, such as a partner or a spouse or family members who they may have been living with or contributing with to their housing. Significant health events, loss of income, and loss of caregiver supports often then contribute to folks' loss of housing, which may be their homes that they own and they're unable to afford because of tax increases, along with their low or limited income, and also maybe because they are renting properties they are no longer able to afford. All of these different factors combine in different ways for an individual, resulting in their first experience of homelessness over the age of 50. How does homelessness impact health? Overall, adults experiencing homelessness are more likely to have chronic conditions and are more likely to have multiple conditions, including physical and behavioral health conditions. Older homeless adults have medical ages that far exceed their biological ages. The general health status of people experiencing homelessness is similar to the health of the population 20 years older. So when we're looking at an individual who's 50 or 55, their health status often matches that of somebody who is 75 or older. Research shows that they experience geriatric medical conditions such as cognitive decline and decreased mobility at rates that are on par, again, with folks that are much older than they are. These conditions, combined with decreased access to supports for chronic condition management, extensive health services such as skilled nursing care, or harm reductive approaches in basic healthcare settings, along with inaccessible environments, all contribute to why these health conditions often worsen and become more unmanageable at younger ages. So diving into the geriatric conditions that are often experienced by adults and older adults experiencing homelessness. These geriatric conditions are a collection of medical conditions that include things like functional impairment, cognitive impairment, visual impairment, hearing impairment and loss, incontinence, and falls that often lead to increased vulnerability and decreased independence. So as we've noted, older adults experiencing homelessness are more likely to experience any and all of these conditions and at an earlier age. This combined with restricted environments, such as living in shelter settings or in places not meant for human habitation, where they do not have access to accessible environments, strategies, or even basic places to complete ADLs, can really restrict their ability to manage their symptoms. Additionally, lack of access to appropriate healthcare services can further contribute to functional decline. For example, we know that there is a link between vision impairment and hearing impairment and cognitive decline. However, many individuals who have decreases or losses of vision and hearing do not have access to supportive and corrective services such as glasses and hearing aids. Without these issues being corrected, folks are more likely to experience falls, which can contribute and cause further health conditions and also contribute to an early onset of cognitive impairment. That is one example, and unfortunately, these vulnerabilities contribute to high rates of unsheltered homelessness. Individuals who are deemed to be unsafe for these environments may not be able to stay in shelter due to their risk of falls, unmanaged incontinence, or other issues.
The relationship between behavioral health conditions, which includes the recognition and treatment of mental health and substance use disorders, and homelessness is both complex and bidirectional, similar to physical health. Behavioral health conditions can contribute to a person becoming homeless. For example, someone with a behavioral health condition may struggle to work a full-time job due to their symptoms and may no longer be able to afford rent, setting in motion the difficult cascade leading towards homelessness. In addition, behavioral health conditions can develop and worsen in the setting of housing instability or after someone becomes unhoused. Evidence shows that people who become homeless have a high risk of developing symptoms of depression and are more likely to experience trauma and traumatic events, putting them at risk of developing PTSD. Someone may begin using substances as a result of or in response to experiencing trauma, to help with sleep in the setting of being unsheltered, to cope with anxiety, stress, or fear related to their situation of being unhoused. Older adults experience the same and sometimes heightened stigma related to behavioral health conditions. For some, these behavioral health conditions may be a new diagnosis related to experiences from later in life, as mental health symptoms may develop as a result of a new medical or psychosocial challenge. For individuals who have been managing mental health challenges throughout their life, aging and new comorbidities may result in a change in how medications are working to manage existing symptoms, or medications may be causing new side effects. Finally, there's a strong interplay between cognitive challenges and cognitive changes and mental health symptoms, making diagnosis and treatment more complex in the older adult population. Substance use is also present in older adults experiencing homelessness. Individuals who have been using substances throughout their life may begin to experience interactions between their use and new health or cognitive conditions. Fear of physiological withdrawal can act as a deterrent to attending to physical health needs. For example, someone who would benefit from going to the hospital for a new or worsening medical condition may choose not to, or be afraid to go and get the care they need out of fear of withdrawal symptoms being undertreated. For individuals who are actually interested in treatment and heightened levels of substance use support, there's often a lack of age-appropriate and cohort-concordant treatment options. And finally, for older adults transitioning to housing, this period of time is a really high-risk time for potential overdose, which is happening at a moment when people are less likely to have other people around. And finally, for individuals who need a higher level of care, so for example, something like supportive housing with additional nursing services on site, those services are often not available to someone who is choosing to continue to use substances. Healthy aging is supported by being able to engage in activities for well-being, modify the environment to support change and function, and access to health services such as geriatric providers and rehabilitation services. People experiencing homelessness do not have the same access to these resources as other older adults might. This can present a challenge to homeless service providers, as people may present with the health and social needs of older adults, but not actually meet the age requirement for services. Healthcare providers may not assess the health conditions that they associate with older adults, and issues like cognitive changes, fall risks, incontinence may go unnoticed. As such, the older adult population experiencing homelessness faces a number of unique challenges, many of these reflective of the way in which different types of services are siloed between the older adult services and the homeless services in the community. Firstly, the homeless response system was not designed to support this cohort, and services such as shelter systems and existing permanent supportive housing models are not yet equipped to support individuals with mobility, functional, or even cognitive support needs. Historically, there has been a siloing of older adult services and homeless response services, with these two groups being unaware of the full spectrum of services available and being offered by the other group. This stands in the way of seamless collaboration. Developing and disseminating approaches to bridging these gaps has been a priority for our teams and went into or as a driver for our creating the courses that Caitlin will share with you in a few moments. In addition, clinical presentations are often complex, with an overlap between behavioral health, neurologic, and cognitive symptoms. And at the same time, these populations often don't have access to neurologic and memory care services and consultants, especially if they're continuing to actively use substances. Appropriate, accessible, and cohort-appropriate substance use or mental health services are often lacking for those interested, and there is a growing need for flexible palliative care and end-of-life care to support this growing and evolving population.
So as Devora noted, there is a gap in services and care specifically for older adults experiencing homelessness. However, the rapid growth of this population has indicated a need for more program services and supports for providers in order to do so. Our job with the National Healthcare for the Homeless Council was to support the development of online courses to address the needs of older adults experiencing homelessness. I'm going to share a little bit of our process in getting and developing these courses. We started with interviews with providers, frontline staff, and people with lived experience of homelessness who have accessed homeless services as older adults. Our frontline staff and provider groups included prescribing providers, nurses, community health workers, case managers, and social workers, along with some researchers across a spectrum of services, settings, and geographic locations. In addition to these interviews, we also completed an environmental scan, which looked at existing literature, promising and best practices around serving older adults with behavioral health conditions, older adults experiencing homelessness, and other chronic and functional conditions to identify what were recommended practices that could be implemented within homeless services settings and would meet the needs identified by the interview staff. This combined with the environmental scan combined with the interviews resulted in the development of the online courses. These online courses, as they were developed, were then reviewed by subject matter experts who were able to review both the content of the course to ensure applicability and relevancy for frontline providers and staff, along with just general accessibility and usability of the courses themselves. And then finally, these courses were published after this extensive review and additional editing. Currently available, there are 3 online courses. All of these courses are free and publicly available. You just need to create a login at each of their respective online course catalogs. The course is available through SAMHSA from their HHRC online course catalog. You can access the course by scanning that QR code at the top right there. This course is a broad course that is focused on understanding the needs of older adults experiencing homelessness and provides direct and tangible strategies to a variety of providers across homeless services settings. The second 2 courses, which were broken into 2 parts, are specifically for folks working within medical respite care programs. These courses also provide a background on understanding the health and social needs of older adults experiencing homelessness, and again provide direct strategies for folks working within the medical respite or recuperative care setting. These courses may also be applicable for those working within shelter settings or in hospital settings who are want to understand needs and concerns for discharge planning for older adults experiencing homelessness that may be hospitalized. We hope that you access the courses that we've shared here and also join us for further education and learning as we continue to identify and develop ways to support older adults experiencing homelessness across our communities and services settings.